Welcome back, everybody. Today we are on video number 2 out of 4 on all things related to home health physical therapy pay. Today we are going to be talking about what you need to know as a home health physical therapist in regards to PDGM. So what is PDGM? PDGM is the patient-driven groupings model. Okay, and this is actually a payment method that was started at the beginning of 2020 by CMS. Although CMS did not intend for there to be any changes in the way that home health was administered, knowing a little bit about PDGM can help you to make the best clinical decisions while understanding how Medicare pays. So in other words, if Medicare pays more for a specific patient, you should probably provide a little bit more care for that patient. If Medicare pays less, you should provide probably a little bit less care for that patient. Sometimes that's not always the case, but as a general rule, that's a good thing to follow. Prior to PDGM, CMS actually incentivized providing additional therapy visits because there were these therapy thresholds. So the more therapy you provided, the more money the home health agency would get. The PDGM changes that by tying payment to 5 different variables. Those include the admission source, the timing, the clinical grouping, functional impairment, and comorbidity adjustments. While it would be impossible to go over absolutely everything in relation to PDGM and how it affects payment, I hope to give you 3 things that you can think about with each patient so you can make a good clinical decision on the frequency and duration of your plan of care. Having an understanding of these things also can help you in your salary negotiations, and we'll be talking all about that in video 4 of this series. In home health, a certification period is 60 days, but PDGM actually works in 30-day billing cycles. What this means is that you only get paid for the cycles that you're actually providing services in. So if you discharge a patient before the end of their first 30 days, you're only getting the amount that's been allocated to that first 30 days. In each 30-day payment cycle, there's what's called a low utilization payment adjustment, or you may have heard the term LUPA. So the low utilization payment adjustment essentially puts a threshold on the minimum number of visits that should be provided for a given patient in each one of these 30 days. In other words, if you don't provide at least that number of visits to a patient, instead of getting the amount that Medicare has designated, you're going to get a lower per visit rate reimbursed to the home health agency. Typically, in the first 30 days, a LUPA is going to be between 4 and 6 visits. So in other words, if you provide, as an agency between all disciplines, less than that threshold, if you don't provide at least that LUPA threshold number, then you're going to be reimbursed at a low per visit rate as opposed to the lump sum that Medicare would otherwise pay for that entire first 30 days. Now the same thing's true for the second 30 days, but the LUPA threshold there is usually between 2 and 3 visits. Now as a physical therapist, you can use this understanding as you're creating your plan of care. So being aware of what those thresholds are in each 30 days can help you to make a good clinical decision on what Medicare would expect for someone that presents with those specific deficits. The second thing that you want to think about is, what is the admission source? So was the patient referred from their primary care, from the community, or were they inpatient within the last 14 days? So if they were discharged from the hospital or skilled nursing or something, within 14 days, they're actually going to be reimbursed at a higher rate than someone coming from the community. So you can use this information to make a better decision about how many visits the patient should have. The last thing to consider is something that's really easy for SPTs. That's their functional level. So think about the OASIS items, whether you're doing the start of care or you're doing the PT evaluation. Think about those OASIS items. If the patient is very independent, they just have a few deficits, they likely don't need as much therapy. Now that makes sense clinically as it does financially, right? So this is easy for SPTs. Think about how impaired they are. If they're more impaired, they should have more visits. Now with these 3 items, you should be able to make good clinical decisions with having a mind towards the financial aspect, the reimbursement from Medicare in regards to your plan of care. Now in the 4th video, we're gonna go over all about how you can use this to negotiate a higher salary in home health for yourself. If you haven't yet, please subscribe to the channel and make sure you ring the bell. That way you don't miss out on any of these upcoming videos. Thank you for watching, and I will talk to you all in the next one.